Good morning, everybody. Welcome to today's webinar. We are really excited for you all to be joining us today. This is a webinar about the digital shift, improving patient access and engagement with a digital front door. Before we get started today, I would like to acknowledge the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Welcome, everybody. My name is Sam Kluge. I'm the Client Engagement Lead at Five Faces, and today joining me is Rach Wolfe.
Hi everyone, I'm Wolfe. I'm the Chief Customer Officer here at Five Faces.
Just a few housekeeping items before we kick off with this morning's webinar. There will be a Q&A box at the bottom of your screen. You're most welcome to jot down any questions you may have that pop up throughout the session today. And there will also be polls scattered throughout the webinar. So we'd love to hear your feedback on what those questions will ask of you today. They will be anonymous, so don't worry about your responses being shared. You also have the option to adjust your camera or the video in the right hand or left hand part of your screen so you can see us a little bit better. Completely up to you. This will be recorded and we will send out this recording to you afterwards. If you have had colleagues who've not been able to attend today, please share it with them. Okay, the number $1 million question. Let's get started. What is the digital front door, Rach?
So starting with the easy question, what is the digital front door? So I think there have been a lot of interpretations or definitions around what is a digital front door. This term, we've seen pop up probably over the last 2 to 3 years. It's become more popular, particularly in healthcare, is where we're seeing it. We haven't really seen that term used more broadly outside of healthcare. It has lots of interpretations and variations. It can be everything from a patient portal through to check-in kiosks when people actually walk through the physical front door of a facility, engaging digitally. We will talk today about what is our interpretation of a digital front door. What have we seen from our healthcare clients about what they're looking for in a digital front door, making sure that it's an end-to-end patient engagement platform. Our interpretation is like it acts as a gateway or a central point for patients to access their information, communicate with their healthcare providers, and really supports patients to interact with their information and with those people involved in providing their care through a secure platform. And that's probably one of the points. It needs to be really secure. And a digital front door needs to accommodate various settings, throughout healthcare. So patients who are engaging with specialist outpatients, community health, allied health, supporting them through their whole patient journey. We look at it as a way of unifying the information for the patient, providing it all in one place, taking away sort of the noise that sits in the background of their care and providing it in one place for them. I think, that's our interpretation, just providing everything for the patient in one place.
And having a central repository, so to speak, of where you can access that information, not just for the day of appointment, but pre and post information that can really help with patient engagement in their own health journey.
Yeah, and I think that's important. The day of the appointment, well, it's a critical part of the patient's journey. It just forms one step. There's a lot that happens pre and post appointment where the patient may actually be, not have visibility about what's happening with their care or how their appointment is progressing.
Absolutely. And as you alluded to before, we know in health that there are a lot of disparate systems in the background, and we don't really need to expose patients to that. But if we can put that that pane of glass over the top of that experience where they can easily interact and engage, then we're going to have more buy-in for patients into their health.
It's really streamlining what is really complex and complicated behind the scenes.
Absolutely. And I'm just going to read this quote from Frost and Sullivan, which I think really sums it up nicely. In just a few short years, the digital front door has shifted from being a nice to have online presence to being a critical part of every healthcare organisation's overarching digital strategy. Now, what's driving healthcare to digitize the front door?
So as we can see, there are definitely two drivers. Patients are acting as consumers. So patients are expecting to have the same experience when they're going through healthcare as they do when they're booking gym classes or
booking a flight.
Yeah, exactly. That, being able to order your meal from your table. We're just really looking for that. Has changed the way that we expect to receive services. We engage with our telcos via a chat, but previously healthcare has been so manual. We've had to pick up the phone and wait for a call center, wait for a letter to come, which may or may not arrive by my appointment time. So I think also patients that are coming through these complex services now are digital natives. They've grown up with a phone in their hand. I know my son, if he receives, he's 20, if he receives a letter from somewhere, he's like, why would you send me a letter? Why not an email or SMS? He doesn't check the mailbox. So really, I think patients are pushing that drive. I think COVID has transformed the way we expect to receive care from healthcare. We saw that healthcare could pivot really quickly for virtual care and telehealth. And I don't know about you, but myself as a patient, I don't want to let that go. I want the flexibility around being able to request a telehealth and have that information on my phone and book my own appointment with my GP. So I think whilst the changes might have been facilitated because of COVID, patients won't want to go backwards. And I think, like you said, they're expecting the airline experience. I can book a flight, check in online, have a boarding pass to scan when I arrive, and I really don't need to speak to a person if I don't want to, if that's the experience.
I think the key theme there is really being respectful that there is a patient and their life at outside of that appointment.
Correct.
And there may not be an opportunity during their day to navigate around scheduling of appointments. And by giving that power back to the patients and their families to do those things at a time and place that is convenient to them.
We all lead really busy lives. So if I wanted to request to reschedule my appointment, to me, picking up the phone during my workday, I'm just going to forget that is top of priority for me. Whereas if when I get home or just before bed at night, I can log in and process that online, to me, that's, a game changer.
Absolutely.
I think the other point is probably the healthcare providers. So healthcare providers are really valuing the patient experience and patient satisfaction. They're measuring it. And whilst, patients might be driving it, I think the healthcare providers are really seeing some efficiencies, not only with the patient experience, which obviously is the priority, but we can have efficiency. So if patients are happy to engage digitally, to check in digitally, to send a message through a request to reschedule, what that does is frees up the time for the staff to concentrate on the patients who are perhaps not as comfortable with digital and support them through their journey, or patients who are anxious upon arrival to support them and spend more time with them, with patients who are more self-sufficient and in control of their healthcare, can use those digital means.
And that's really important. I mean, not everyone will digitally adopt. We're going to have people who will still want to and choose to engage with staff. Staff are never going to be going away. This is not replacing staff at all. It's more creating efficiencies and workflows, but also allowing for those consumers or patients to have that that connected experience with the admin staff who may have that extra bit of time to allocate to the patients who are a little bit resistant and not wanting to engage digitally.
100%. And instead of, you know, feeling anxious because I have a queue of 20 people trying to check in, I might have one or two, and I can take time. I can also take time for data quality, updating their information, and spend more time on those quality activities and those quality patient contacts rather than more transactional. So it actually will improve patient experience for those not even using a digital front door.
100%. Well, we've landed at our very first poll during the session today. First question here is, what are the benefits of a digital front door for a patient and for a healthcare provider? So I will just launch that here for you now. So put yourselves in the shoes of a patient or your own personal experience as a patient at some point. How would having a digital patient hub benefit patients most? Then think about the key benefits of digitising workflows as a healthcare provider. And there are a few multiple choice options there for you. And look, it's really clear immediately that major benefits are going to be engaging digitally, time saving and efficiency is a huge one. And that autonomy and partnership is really key. I mean, just because you have a new system doesn't mean that you're going to remove that engagement with the staff and the patient. It's more collaborating and working together to be able to just enhance that overall experience.
And I think the response for more control of care is really important too. Like, you know, often as patients, we felt quite powerless. We receive a letter saying, your appointment is next Tuesday. If you don't bring your Medicare card, you will be billed, you know, rather than actually I do have some control over when I might be able to attend an appointment, provide some options, not always going to be able to be facilitated, but it just provides the patients with options.
Yeah, absolutely.
Some control. Yeah.
And what I love to see with the benefits for healthcare providers is that the majority of our audience today are loving the fact that there is an efficient use of healthcare resources with the implementation of a digital front door.
Yeah, and I think that operational efficiency and workflows that we're seeing there, we'll touch on a bit later, but can actually create so much efficiency through automation of workflows and automation of messages and take away some of those manual inputs that staff are seeing.
Absolutely. Okay, we'll jump back into the presentation. Thank you everyone for participating in that poll. Let's put this in place in the real world. Let's use an example and see how this just impacts patients and how we can see where a digital front door would interact with a real case scenario. So we've got Emma here. Emma is a 45-year-old busy mum of two, maintaining a busy life. She has been recently diagnosed with breast cancer and is managing multiple appointments at an oncology clinic. As you can imagine, in her current state, she's feeling pretty nervous. She's anxious about all of the things she needs to maintain in her life, let alone the various appointments she needs to attend with her current condition. She is digitally mature, so we're thinking here she's going to adopt fairly well to this new type of system that she would be presented with. But what would it look like for Emma if she was given the opportunity to have a digital front door?
Yeah, so I guess for someone like Emma, her care is quite complex. She's newly diagnosed, so you're being bombarded with a lot of information, which is actually, we've heard from consumers when you're delivered that diagnosis, that news, that protocol of what is your care plan going to be, it's very overwhelming. You probably, you're hearing a lot of white noise and you walk out and you think, oh, what did they say and what's next and what do I need to do now? So providing a digital front door, which is really like a central hub where patients can see all their upcoming appointments. And when we talk about those upcoming appointments, someone like Emma, she might have appointments for, a specialist consultation, her chemotherapy. She's going to have radiology appointments. She might want to seek social work support, or welfare. So really, the patient doesn't care where the appointment is coming from. And we, like you mentioned earlier, we have the disparate systems that sit in the background of healthcare. They're often archaic. So appointments can be scheduled in a PAS and an EMR, all for one facility, a PAS, an EMR, a RIS for medical imaging. And someone like Emma, her healthcare provider might use Charm to schedule her chemotherapy. Emma doesn't care where those appointments are scheduled. She just wants them all to come through in one place. So she sees a sequential view of all her appointments so she can manage her life around it. Previously, she might have received letters for one appointment type, SMSs for another. It's very confusing. Also being able to have resource library. So for someone like Emma, who's newly diagnosed and coming in for her first oncology appointment, she can actually receive, almost like a welcome pack within the patient hub. And that could be what to expect on your first chemotherapy appointment. What can you bring? Please bring, someone for support. Any forms that you need to complete digitally. So rather than trying to work out, I'm going to have to fill out a paper form, how do I send that back? Just having that there, having some reminders, completing it digitally and submitting it, taking away, sort of driving the steps on what she needs to do next and what she needs to read next.
In a scenario that is incredibly overwhelming and you're in such a vulnerable state that feeling like you have some kind of power around navigating around your day-to-day may seem small but is massive in this type of scenario.
Yeah, absolutely. And it's not just about the appointment, it's knowing how to prepare for an appointment. How do I navigate there? They might be delivered across multiple locations. How do I find that facility and actually find the clinic when I arrive? It's really anxiety driving for a lot of consumers, especially, as you said, when they are in a vulnerable state. But, this doesn't just affect Emma. This diagnosis, she is a mum, it affects a whole family and a whole support network around her. So being able to provide resources to Emma that she can share with family, friends, community support with how best to support her through this journey as well, I think is really important.
All of this can seem like it is amazing for the patient, which it is, but I can appreciate that it could be potentially overwhelming from a staff's perspective to see just what sits in the background and what the staff experience could look like. Could you walk us through just how the patient hub translates to a staff console in the digital front door?
Yeah, I think it's important when you're implementing solutions like this. We don't want to duplicate workflows. We've worked in a hospital environment before. We know that the staff working there already need to go into multiple systems to update the patient's demographics, check them in one solution, billing in another. The last thing that we want to do is keep creating more workflows and more inefficiencies. This should be driving efficiencies and make it easy to use. A lot of these healthcare systems, they're complex patients, complex workflows. So using them can be quite complex and complicated too. So I think providing a very easy to use, easy to navigate, I want to say like noiseless, so make it as clean as possible. Don't clutter the environment with a lot of information and a lot of functions. But you can see here, we can see a staff member. This is an example of one of our user interfaces where a staff member can really quickly and easily send a resource to a patient, monitor their clinic as they're coming through the day. The other really key point there is integration. Making sure that we integrate with the source system so staff aren't having to duplicate that information. That's really important, but not the source of truth for the appointment scheduling in this scenario. So we're pulling that information through and to present it in the front end and keep those systems in sync. I think one of the other things is local configuration controls, and I know we're going to touch on implementation later, but providing some of those configuration controls to the hospital to really define workflows through a clinic, noting that each clinic is that little bit different. They have different workflows, they have different requirements, and I think gone are the days where you just have to adapt to the technology. The technology should adapt to you, your clinic, and your patients.
One size fits all. But we've seen that doesn't work. We need to to prioritize how the clinics operate and use that moving forward into how we shape the admin console moving forward.
Absolutely.
In the poll, we were talking about just those benefits on a healthcare system and how we can reallocate healthcare resources optimally. We've also got other major organizational benefits. I think the biggest one that stands out is, well, obviously on the page here, consumable items and their cost massively decrease, but this tool really reduces failure to attend, doesn't it?
It does. And I think, we talk about a digital front door a lot, and the driver, has to be patient engagement and patient experience. But, healthcare, we, all have tight budgets. There does also need to be a return on investment and some operational efficiencies. So the reduction in did not attend, we saw for one large public healthcare provider, a 60% reduction in did not attend rate for appointments. And whilst we always knew that could be one of the benefits, we thought that amount was outstanding, amazing, and they were thrilled. And we looked into, why would a digital front door reduce the did not attend? We're just providing the reminders and notifications in a different way. But a lot of it is we can actually send those reminders in the patient's preferred language. Patients were receiving SMS appointment notifications in English when they didn't speak English. So how do they know they have an appointment? They struggle to call and request information. So being able to provide that information to the patient in their hands, in their preferred language, and even to trigger notifications at a certain cadence depending on the appointment type. So if a certain appointment type has a higher failure to attend rate, you can actually send more notifications that will look at when they're sent to provide those patients with more or less notifications. And I think, the other one you touched on was the consumable costs. So sending letters, I think we look at it's about $3 per appointment letter or paper form that is sent out to a patient. And these large healthcare providers are sending perhaps millions of these over a year. Being able to reduce those costs and digitize it is a great saving. But also most organizations are looking at sustainability targets at the moment, which we should be. So these can actually help them reach their sustainability targets rather than using so much paper and printing and the effort that comes with postage.
Absolutely. And as we've said throughout, those letters will continue for patients who do not buy into having a patient hub, but having these reductions is phenomenal, really. We touched on before the ability to lower failure to attend because of that providing that language translation. Accessibility is so important, isn't it?
Yeah.
We need to cater to all needs of patients, whether it be through culturally and linguistically, accessibility through screen readers, of voice to text, text to voice. Accessibility is more than just a tick box now, isn't it?
Yeah, absolutely. You know, when you touch on literacy, you know, we need to look at when a patient is receiving information within a patient hub, whether that's a resource, whether that's a message, an automated message, you know, we need to look at, there are different levels of literacy. You know, reading literacy, absolutely don't overcomplicate the language that is used. We use a lot of acronyms in healthcare, and particularly IT in healthcare. It is another language. We often make assumptions that that makes sense for us. I think you and I did some consumer engagement some time ago, and we assumed everyone knew what a referral was and what that meant and what the category meant. But actually providing that in practical language to the patient made a huge difference. The other one is digital literacy, making sure that the solution is easy to use, easy to navigate, you know, and then the health literacy. And we actually see this as a huge benefit of using a digital front door, is engaging patients in their healthcare, providing information that is easy to use, easy to access, will actually improve health literacy of the patients and bring them on the journey. So I think with accessibility too, from a software development point of view, we need to really develop with that accessibility in mind. And when we talk about that, it's making sure that everything is compatible with the screen reader for patients with varying levels of visual impairment, making sure that the color palette and the font is easy to differentiate from the font and the background color, making sure the button size is easy. If we're looking at some patients who may be slightly older, it can be quite hard sometimes, even for myself, maybe I'm slightly older, but it might be hard sometimes to select those buttons, when they're really small. So just taking it through that lens
removing
is really important.
Any barrier to make sure that we have adoption from all levels.
Yeah, 100%. And then making sure that the information is available in the patient's preferred language. So a patient may be able to speak English to navigate through their day, but when you're consuming healthcare information as something that's so important for what's happening with you and your family at the moment, being able to see that in your preferred language and understand it clearer is really important. So being able to translate that messaging to the patient.
Huge benefit. So how do we go about this? How do we get these beautiful images of our digital front door? How do we actually get them into our healthcare services? How do we look at implementing? Is it a step-by-step process? Do we just go in straight away?
It's just easy.
Dump?
Just turn it on. Just turn it on. So I think there are different approaches, and I think what we're seeing is a shift from the Big Bang approach. And I think the Big Bang approach does have its merits in that it's rip off the Band-Aid. It's in support all the staff and all the patients in one, and the project team is there and it's intense. But I think what we've seen from that is the solution is designed to support so many workflows of variations, and then we just turn it on and we didn't know what we don't know. So after go live, there's a lot of scramble for, it's not quite working. So I think what we can see is like a staged approach, and that can be done in multiple ways. It could be done with piloting in a clinic. So pick a clinic or a specialty with complex workflows. Work through the complexity first, and maybe the rest will fall into place. And then what healthcare providers, what you should be able to do is then tweak the solution to fit. What worked, what didn't work? Okay, well, we've got lessons learned. That's not quite the workflow we're expecting or the experience we're seeing. Being able to tweak it before and then it's rolled out further. So you're constantly innovating and constantly improving rather than turn it on and live with what we have.
It's a sustainable approach, really, to making sure that we've got this for the long haul and not something for a few years and, hey, there's no adoption. But really, what's the point in that? We want to move forward and we want to improve the experience for our patients and the staff.
Yeah, and one of the clients that we're working with at the moment, I mean, this is a real luxury, not a luxury everyone has, but they have a prototype lab where, you know, we're putting this in with the integrating solutions and we're building for the lab, but they have 12 months to play, to reconfigure, to train, to test in simulation of a real hospital clinic environment before it's actually implemented. And as I say, that is a luxury, but you can do that in small with, you know, 1 or 2 clinics. And I think the other approach is you can actually solve what is an immediate problem and then scale up. So rather than scaling out geographically, you know, let's say we need to digitize our forms, you know, a registration form or whatever it might be, you can digitize that and go, actually, you know, we had great adoption, that's giving us great data. Let's scale up and allow patients to digitally check in. Resource sharing, so you can actually turn on modules and build out the solution in that phased approach is another way.
Yeah, really do it consciously and not just go, let's just get it out there and hope for the best. Like, let's actually focus on what's our priority now, and we can just we can work up to the unicorn state that we want to be in. But of course, along the way in implementations, we know that it doesn't always go smooth sailing. You mentioned before with the Big Bang approach, you're going to have conflicting workflows, and there's going to be complex and complicated work streams within an organization. Just what are those challenges that could contribute to approaching an implementation like a digital front door?
Yeah, look, I think integration is always going to be a challenge. We do need to integrate it. It's key to bringing that information from the source systems. Like you said, there are disparate systems. There are a lot of systems we need to pull information from. Integrating with them can be quite challenging. You know, they're really large scale systems. Some of them have been in place for 20, 30 plus years. So I think that is a challenge that we do need to overcome. I think configuration is one of the challenges, as in making sure that we hand over a solution, or software providers, digital front door providers hand over a solution that is actually belongs to the facility and the healthcare facility. We hand over that control, because workflows change, messaging changes, resources change, and we want the solution to change with them. We want them to be able to update it themselves rather than this technical lag that they experience with having to put in a change request with a vendor and wait for development and testing. We want to actually hand over that control. And I think with that configuration also comes noting there are differences, as we mentioned, between the clinics and the workflows. You know, how a fracture clinic runs is very different to how an oncology clinic runs. So there need to be configurable workflows, configurable messaging to support that.
And in our experience, I think the big thing, there is a big thing when that isn't acknowledged, that workflows and work streams can be incredibly different. And if that isn't acknowledged, that the whole training and adoption process can be met with a lot of there's a huge barrier there, really. So by acknowledging that we can tailor these processes, ultimately can change someone from being significantly resistant to being hopefully a champion of their area, because their whole work process was acknowledged and they can champion it.
I think you said it beautifully the other day, Sammy, where you said these implementations really are more of a people project than an IT implementation project. And like, absolutely, that's perfect. It's not only about turning it on, building it, implementing it, configuring it, turning it on. It's actually about bringing the staff, the patients, the volunteers who are pointing them in the right direction, on the journey right from beginning through to end.
Everyone has a role. We're not being dictated by a solution. We've got people driving it. We mentioned before about eating the elephant on the previous slide. Can you walk us through what that concept means?
Yeah, I think this goes back to the Big Bang approach. It doesn't have to be perfect on day one. It doesn't have to be perfect, and you don't have to do everything on day one. Don't aim for that perfection. Recognize that it is iterative. It's a transformation project as much as it's a people project. So, you know, balancing what are our short-term pain points that we're trying to solve now? What are our short-term goals? You know, our short-term goal might be improving the waiting experience for patients, versus what are our long-term goals? And they might be, you know, the financial benefits that come with, you know, having a digital front door solution. So really mapping that out. What do we need to fix now? What are we trying to solve now? And what's our end game? Which I think comes to the eating the elephant, you know, versus the stepped approach. And before we even get to implementing, it's actually mapping the patient journey. You know, trying to work out what are the touch points with a patient and how are they currently, how's that currently happening? Is that an SMS? Is it a letter? Is it a phone call? And what needs to stay as is and what needs to be replaced, or what can potentially be replaced with the digital front door? You know, identifying the gaps. You know, what can't we do now? What can't we deliver to patients that maybe a solution like this can fill the void?
And where can we add value? Where can we add additional resources to aid the health service to better educate their patients, whether it be around wayfinding or various resources about the condition they may have or whatnot. It's just really trying to find value that may be there, but it can be enhanced by having access to more.
Yeah, absolutely.
We've arrived at our final poll, which is, where are you on your digital front door journey? So super keen to hear where our audience is at the moment, and what are your biggest challenges implementing a digital front door? So I'll just launch that one shortly. So we either haven't started yet, started but progressing slowly, could be progressing with some challenges, or well progressed in your journey.
There we go. Some are starting to come through. It's interesting that we haven't had anyone well progressed yet. So, and I think that has been interesting with the rise of the digital front door, you know, focus in healthcare, that everyone's talking about it, but no one seems to be well progressed in it yet. So we're all implementing, working towards it, but it's taken time.
It's all top of mind, but we're yet to dive really deep in. Okay. Thank you very much, everyone, for participating in the poll. It's hugely useful to us. I'd now like to open up the next question to you, Rach, around the future of the digital front door. Yes, we're at that stage where we're not well progressed in the journey, but what are we looking at in a future state? Where could we get to?
Yeah, so I think at the moment, the real focus, I mean, that we're seeing of the digital front door is supporting those large, complex healthcare environments. Really, they are focusing on that sort of outpatient journey and experience, which, you know, makes sense because the volume through there, the complexity of patients coming through there, it makes sense that that's the first workflow to tackle as such. But it is just one part of the patient journey. If we think back to Emma, Emma's going to also, you know, have some admissions. She may present to emergency if she develops a fever. She'll need to go to pathology and radiology. So it's actually about looking at how does the digital front door branch out to support those other avenues of healthcare. So, you know, if I have a planned admission, you know, elective surgery, you know, about letting me know that it has been booked, and providing me reminders on I need to fast, you know, and also wayfinding, you know, that might be somewhere in the hospital I've never been, or at another facility. Looking at, you know, for Emma, she might need to request medications from the hospital pharmacy. For Emma, being able to request that and know when they're ready to collect rather than waiting around all day. So really sort of expanding out to support those other services. I think the other one that's really important is, you know, we touched on before, it's not just about the patient and the hospital. You know, there's a whole wraparound support for patients, you know, well, for most patients, and we like to think there is in the community of their family, friends, GP, neighbours, community support. So it's actually about how can we provide that wraparound care for the patient and bring the loved ones on the journey, provide them with information, or provide the patient with a way to share that information, you know.
Share the load.
Share the load, and a neighbour might be helping a patient to get to their appointment.
Yeah.
So for them to be able to see, oh, you know, when are Emma's appointments, you know, if they're provided with that privilege to help, you know, take Emma to her appointments, providing a pack for how can family and friends support a patient through their cancer journey. I think that's really important. It's tricky to navigate, you know, sharing that information, but I think the benefits for the patient are huge in that instance. If we look at the technology, you know, AI, it's top of everyone's mind. You know, it's a real focus at the moment, but by implementing AI in these solutions, a patient shouldn't actually know that it's AI driving some of these workflows. But, you know, we've been looking at AI language translation. So previously in healthcare, we've really stayed away from any automated language translation because it's tricky and it's risky. But looking at AI language translation is coming such a long way and coming so far. Being able to share information with the patients in their preferred language, but they can also communicate back in their preferred language, and the staff at the other end can see it in English or however they need to review that information. So being able to open up those avenues even further, I think, is an absolute game changer.
And how could we utilize with our current, for example, functionality around forms? How does AI feed into form development?
Yeah, so it could lead into, you know, OCR. So being able to, you know, currently with our forms, we can send, you know, the data back into a source system if there's somewhere to catch it. But if you think of a patient with an updated referral, being able to take a photo of that referral, share it, and for OCR to pick up those key elements of the patient identifiers, you know, who the referral is to, the referral dates, you know, and drive that into a system is a real, you know, effort saving.
Yeah, massive. I am conscious of time and could talk on and on about the advancements in AI, but I will keep going as I know that there are some questions coming through, and I would like to get to just a couple before we do round out today. So thank you for for the questions that have come in already, and please feel free to send any more in. There is just a quick message around whether this will be recorded, and it will be, Sarah. We will send out all of the video recordings to our mailing list who signed up today. Please feel free to share to your colleagues. We have a question here that says, how do you engage consumers to ensure the solution is fit for purpose?
Yeah, so I think obviously that's critical. You know, I think it's important to engage consumers, whether that's patients, family, community members, right from the start of the journey if you can. So, you know, we've worked on a project where there was a consumer rep or a patient rep engaged right from actually writing the requirements through to post implementation. And what we found when the requirements were being elicited was what we assumed was a mandatory or a key requirement. The patient was kind of like, oh, no, I actually think it would be more important if the patient could do X, Y, Z or see, you know, certain information. So we make a lot of assumptions about what the patient wants and what the patient needs. So I think engage them right from the beginning through to post implementation. How are patients supported? What's the messaging to patients? You know, yes, we have a digital front door. If you don't use it, that's okay. You will still be supported through your journey. You will still receive letters and you can still walk up to a clinic.
Absolutely. And we have a message here about just the importance of patient journey mapping and how helpful that is in the process of developing not only requirements, but developing and configuring your local system.
Yeah, absolutely.
I'll just touch on one last message, one last question, I should say, and for all the other questions that we haven't been able to get to, we will engage you separately outside of this session, so thank you. But the last one we will touch on is, how do you ensure consumers are engaged in the deployment process for a digital front door? So we've spoken about the requirement gathering and the workshop stage, but come implementation and your go live, how do we make sure that messaging and training, so to speak, is there?
Yeah, so I think the messaging needs to be warm. The messaging needs to be warm, it needs to be friendly, and it needs to actually point to what are the benefits for the consumers. Don't overcomplicate it. What will they be able to do? Why are we implementing this? This is to support them. And you know, what happens if they don't opt to use the digital front door? I think that's really important. I think making sure that the content still has the tone of the health service. We don't, you know, if we're deploying a 5 Faces digital front door, we don't want the message to come from 5 Faces. And we certainly don't assume to write the messaging. The messaging needs to be consistent with what's already coming from the health service.
Absolutely.
So I think that's really important.
And I do want to touch on this last one. I think it's really key that we also talk about other organisations that are not only just large organisations, but the smaller healthcare providers. I love that question because we do cater to not just your large HHSs, right?
Yeah, absolutely. So we have really focused on that today, but I think you know, for a large public healthcare organisation, you know, they have really embedded scheduling solutions and referral management solutions. But when you're providing a digital front door, we can provide that appointment scheduling, so the patient can, you know, schedule their own appointment into the solution and receive that instant notification back. They can plan their day as they're booking their appointment and see, you know, when is next, and receive that confirmation back from the provider if required. So yeah, we can be that source of truth also, which, you know, then does tackle that interoperability and integration issue as well.
Yeah, thank you. Okay, I think that rounds out all of the questions we have time for today. I just want to extend a massive thank you to everyone who joined the webinar today. Please feel free to reach out to either Rachel or myself if you have any further questions about the content we covered during the webinar. We are more than happy, I should say, to have a chat about any of your questions that may have come up. But again, a massive thank you, and we look forward to hopefully seeing you at HIC in a few weeks' time. But have a wonderful day, and thank you for your time, Rach.
Thanks, Sammy. Thanks, everyone.